मैम आप लाइव हो गए।
Hello, everyone. Good afternoon. Uh, Today, our topic for the day is mental disorders and blood disorder, along with blood disorders. Dr. Meenakshi has been doing a series on blood disorders, and today we are going to see how mental disorders are linked to blood disorders. Sakshi, can you pull up the slides, please? Thank you. Blood disorders and mental health. Okay. We know we've been doing this series on mental health for some time. Uh, and we know that we have psychosomatic responses, which is our body response to the stress and the anxiety and whatever it is that we are going through mentally. And it may also cause blood disorders or have a bearing or have an effect on blood. And that's what we are going to see today. The next slide, please. Okay. The first question which I'm asked, and this is essentially a question answer format. The first question that I've been asked repeatedly is, can blood tests show mental illness? Okay, so a simple blood test that a doctor uses to diagnose other illnesses by which he can offer treatment doesn't necessarily work with mental illnesses, because the symptoms of the mental illness are varied. It is very, very specific to the person. And so, therefore, the treatment also is customized, and the medication or whatever the treatment is very, very specific to the patient. And for that, uh, there isn't one kind of test that can uh, give you what the mental disorder is. But people are trying, and doctors are trying, and clinicians are trying to find something where any kind of change in the blood number or the blood work can give you an indication of a specific disease. Now, there's a study published in the molecular psychiatry that showed that the biological signature of schizophrenia can be identified in the blood. So, biological signature means there is something different biologically uh, in the blood, okay, that can be identified, which separates the people who suffer from schizophrenia, uh, separates them from people who don't, okay, and can also maybe help with identifying other overlapping symptoms. Okay, so not a specific test yet, but they are developing tests. Next slide, please. Does mental health affect blood? Okay, people experiencing, especially people experiencing depression, anxiety, stress, and even PTSD over a period of time, especially when it's chronic and not acute. Now, chronic is when it's over a period of time. Acute is very seriously and very intensively at that moment. Okay. So if you have a chronic problem, like if you have a chronic depression, if you have chronic anxiety, if you have chronic stress, or even PTSD over a period of time, it shows an increased cardiac reactivity. That is, increased heart rate and blood pressure. Blood pressure is very, very significant where depression is concerned. Okay, and it has a reduced blood flow to the uh, heart, causing multiple cardiac ailments. And because of the higher level of cortisol, especially when you are stressed and then the body produces cortisol, it affects the blood. It affects the hormone, and therefore it affects the blood. Next slide. Bleeding disorder. So this is one of the disorders that Dr. Meenakshi may have covered. Now, bleeding disorders is uh, especially hemophilia is the inability of the blood to form clots. And there's again a study in 2007, the study of adult male with hemophilia, conducted by the researchers of Arizona, University of Arizona, found in Tucson, found that the number was accurate among the group study, which means that 37% of men surveyed uh, had experienced depression because of hemophilia, okay, and associated with hemophilia. So it's not because of hemophilia that they will have depression, but they may have depression and it becomes a cycle. Those in bleeding disorders community may experience issues related to their treatment. So they will experience anxiety or stress or even PTSD depending on their treatment, especially if there is cancer related. There will be, and there are others such as needle phobia, which a lot of people have. This time during the pandemic, where everybody had to take vaccines, you came across so many people who had the needle phobia and they refused to get the vaccine because of this phobia. Uh, uh, if the person has HIV, AIDS, obviously there is a bearing on their blood levels and the blood report, and hemophilia, and also associated depression. Next slide, please. What is cardiac psychosis? Now, if a person has a cardiac ailment, okay, or if the person has an issue with the heart, long term cardiac ailment, it has been found that it causes fear and anxiety, obviously, because the person feels that they are unwell and they are. Uh, uh, it is a heart, it's like a life threatening disease which becomes more and more acute and therefore also uh, enhances, I don't want to say enhances, but it also contributes more to their cardiac episode and heart disease. Next slide. Can blood pressure affect mental health? Very much so. You may think of mental health disorders when you think about, you may not think that, oh, blood pressure is related to mental health. Uh, if you have hypertension, you are more likely to experience mood issues such as anxiety, depression, PTSD than those with normal blood pressure. This means that if you have hypertension, if you have blood pressure issues, then you are more prone, okay, to experience these mental health issues than somebody who has normal blood pressure. Anxiety and depression. Now, these are two mental health illnesses that are really, really uh, very, very common, and they are not psychotic, and they are neurotic disorders, and they have shown that they are very closely related to blood diseases or blood disorders. Uh, for example, if there is a mental disorder which is called anorexia, where and there is bulimia, and so here there is food related. So it's a eating disorder, and therefore when you eat less, or you if you're bulimic, you will vomit the food that you have eaten repeatedly during the day, and this obviously causes lower hemoglobin and obviously causes other related ailments, but definitely has a big bearing on the blood. In patients with anxiety and depression disorders and schizophrenia, abnormal blood tests show improvement after blood therapy. So, when there is psychotherapy, psychotherapy is when the person goes into, is one of the treatments, and when the person goes to a psychotherapist or a counselor or a psychologist, they have seen that the anxiety, depression, and schizophrenia, which is a very important study, have shown improvement. The symptoms have shown improvement, okay, after, and therefore the blood work has also shown improvement. So therefore you can kind of understand that there is a correlation between mental health, especially these two disorders, anxiety and depression, to blood related ailments. Right. So now that's what I wanted to say. I would love to take questions. There are a bunch of questions. Let me just address them. Shakshi, should I do that now, or?
Yes, ma'am. I can put the questions on screen and then you may
Oh,
address if that.
that would be perfect. Thank you. Thank you. Anisha, what are the first signs of depression? If you feel, first of all, depression means sad mood. Depression means a prolonged sad mood, which means for 2 months, 3 months, 4 months, if you haven't been happy about anything, you cry unnecessarily for no reason. You find that there is a pressure on your heart, and you feel that I'm unable to talk about it. You feel hopeless and helpless. Those are the first signs of depression. If and for So that's something that you have to understand. It doesn't mean that the person is completely cut off from social life. Maybe that they will be cut off from social life, but doesn't have to be like that. But if there is a sad mood for a prolonged time, then it is definitely depression. What causes mental health problems? It's a combination of the environment and the person physiology. Sometimes mental ailments have to do with the the imbalance in the hormones, and sometimes it has to do with the environmental factors. Sometimes it can also be due to pressure, stress, some kind of event, some kind of trauma that the person goes through. So there are a varied number of causes for mental ailments or mental diseases. Uh, if there is hereditary also plays a part in this. If there is a patient in the house who has mental ailments or mental health issues, there is a good chance that somebody down the line can have a mental ailment. Sir, these are prescription drugs. I will not be able to comment on these, please.
Ma'am, we can close the session. Ma'am, if you could just give your ending remarks, we will close the session. That's okay.
Oh,
We have one more question. If
yeah, sure, sure. Tell me. Someone takes antidepressant medication, will other problems occur after stopping? If you are taking antidepressants, you have to make sure that you consult the doctor before stopping. It's very important. The doctor will taper them down. You cannot stop any prescription psychotropic drug without tapering the dose. It has to be tapered down. It cannot be stopped abruptly. You will go through a lot of withdrawal and you will have more issues. So, I mean, it can be stopped if you're already feeling better and you feel I don't need the drug. I would suggest continue psychotherapy and get your doctor to taper the drug down.
we can close, ma'am. Please just give your closing remarks and then I'll stop.
Okay. Thank you very much. Hope you all have a good rest of the day. Uh, if there is any other question, I can take in 1 minute, but I don't think that is. Okay. All right. Thank you. Have a good day, everyone. Bye bye.